Thanks for the great introduction. I appreciate that, and I'm also sorry that folks had to listen to all of that. But I do have a slide. I'll say a few things more about myself, just in the context of my role and what I want to talk with folks about today. I'm certain that I've had the pleasure of meeting many of you throughout the past few years. And if I haven't, just let me tell you a little bit about myself. I am the director of our state division of mental health, developmental disabilities, and substance use services. And so we are responsible for the public mental health, substance use, IDD, and TBI system. We also operate the North Carolina Problem Gambling Program. All of this is done especially in our substance use system, but everything is done in partnership with the community. So I really want to thank all of our partners in the substance use prevention, treatment, and recovery space. I want to thank the Governor's Institute, and always want to thank my wonderful team. So you all know Dee Dee and Anna and Pam and Smith. I know Smith is retired now. I'm still getting used to that. But really proud of our team and the work that they do. Also want to give a shout out to all of our recovery community partners, consumers, families. So all of our work really is your work, and we're grateful to be a partner. I've been in this field for a long time, and as Jeremy said, I do have, as most of us do, right, lived experience, both mental health, substance use, justice involvement, intellectual and developmental disabilities. Lots of very close family members and friends with significant mental health or substance use issues. And so I speak from experience, and I'm really pleased and proud to be in this job and to join you today. What I wanted to spend a bit talking about today is actually, we are at the state level, right? So this is my opportunity to share with you what our vision and our goals are for the substance use prevention, treatment, and recovery system, specific to youth and adolescents, and also where we're going to prioritize some of our time and attention. So for us, that means time, staff attention, our contracts and commitment to you, funding opportunities, how we might use some of our federal funds, state dollars, how we'll ask LME MCOs and providers to work with us. So I want you to know those things. And as I say those things, I say we've developed our goals in cooperation with the community, and I'm asking for your help because this is our system. We hope we got our goals and interventions right, and we hope to work with you on them. This is just our mission and vision and principles. I just put them up because I think they're a good reminder for us that everything that we're trying to do here at the division is about with the vision that people are able to live the happiest, healthiest lives in their community, because everyone deserves that. We are very grounded in the notion of lived experience, people with lived experience driving the system. And we do need an equitable and inclusive system. And we know that for individuals with mental health or substance use issues, it is not an equitable world. It's not. It hasn't been for a very long time. And it's important to keep talking about equity and inclusivity in those spaces. And we also know that when you layer in rurality, race, gender, socioeconomic status, that the disparities grow even further. So as we look at our work, we think of those dual lenses of equity and inclusivity. And one of the things I really want to applaud the Governor's Institute and all of you on this call for really is it's absolutely important to have access, but we've got to have quality services that are driven in research, driven by people with lived experience, and are meaningful and help people on their recovery journeys. So I'm proud of that work that the Governor's Institute is a wonderful partner in helping us promote with all kinds of things every single week, but certainly with trainings like this. Okay, these are our strategic priorities for the next 5 years. And what I'm telling you about them, just to show you that obviously one of the 7 priorities for us as a state is about preventing substance misuse and overdose. I'm going to unpack that one a little bit more. But obviously, all of these things touch youth and adolescents. They just do. Everything from increasing access to care. Part of that actually includes an anti-stigma campaign, specifically related to opioid use disorder and substance use disorder that will have some targeting towards youth, to our crisis system, where we're working to make sure that our crisis system also is prepared for overdoses and induction, and that we're targeting, and we have special crisis programs for youth. We know children in the adolescents and youth in the justice system need very specific, available evidence-based services. So all of these touch youth and adolescents, all of these areas. But the one I'm going to talk most about today is our priority number 3, which is around preventing substance misuse and overdose. Our goals you're not going to be stunned when you see our goals. You're not. Which is good. Our goal is to increase primary prevention, and we want it to be effective. And we also want to increase access to evidence-based treatment across the state. I think, pretty typical goals, right? And these very much feel like process goals. I appreciate that. But the bigger goals, of course, yes, when we engage individuals in evidence-based treatment, we are hoping for happier, healthier youth and adolescents who live full and wonderful lives with all the kind of outcomes that we're hoping for them. Okay, under those goals, we have some very specific interventions we're going to be focused on this year and the next. And as always, with your partnership, we will change the things that we focus on if we find these aren't working or we need to add additional areas of focus. But the things with stars are the things I'm going to talk a little bit more about today. Obviously, we're going to talk about prevention quite a bit. We'll also hit on collegiate harm reduction, just this notion of expanding treatment access, substance use treatment access for adolescents. I'm going to share some data with you that shows kind of a persistent lack of treatment access in our system, which doesn't surprise anyone, right? I mean, that's why we're having this focus and this concentration in this conference and efforts. We won't talk about updating our naloxone saturation plan and distribution. We've been working a lot on that to get as much naloxone out, especially to communities who need it, so it is free. We've done a lot to make distribution actually easier, so that's going well. We are doing a lot to work on our medications for opioid use disorder saturation plan. So we'll talk about that a little bit more too. And that really is about us honestly looking at places and spaces where MOUD is not available. And one of the places and spaces is we don't necessarily have a lot of MOUD that is well known, well accepted, and well used for youth and adolescents. That doesn't mean there's not absolutely pockets of wonderfulness, but it does mean that we know that we need to do more, both for youth and adolescents. We're very excited about having the first mobile OTP units get out into communities. That's coming soon. We are very invested in expanding more office-based opioid treatment because we want, again, evidence-based treatment to be available in whatever setting an individual presents at, whatever setting they're comfortable at. And then want to just expand this notion of just a recovery-based place, not just for young people in colleges, but how do we have recovery-based communities across North Carolina? And what does that look like for children and youth? That's really part of our prevention thinking right now. So I'm going to share some data and walk through some of these things. I'm going to walk through prevention, touch on collegiate harm reduction, just really touch on the expansion of services that we know that we need, and some of the other things with STARS. So this is a data point that we look at a lot, and you've probably seen me in other venues present on this. So these are prevalence rates. I think they're from 2023, and I'm really looking at that 7.7% of youth ages 12 to 17 have a substance use issue. And the bar graphs you're looking at, both the left in particular, the right is for adults, but the left, my left, the one that says child, I'm trying to think of how you're seeing this slide. I think it's your left as well. But if you look at that line, we are looking at the number of folks who are getting the number of adolescents, children and adolescents 3 to 17, that are actually getting substance use treatment. And if you see that blue line, it's persistently low. It really is. So though we think close to 8% of the population, right, best data guesses in 2023, have a bona fide substance misuse disorder, far less than 1% are actually receiving that state-funded service. So that's the state-funded service. So that's block grant, state funds. On the bottom, though, let's look at Medicaid. So Medicaid, though, unfortunately, is still pretty low, right? So, and most of the kids in our system, but not all, do have Medicaid. But if you look at the number of youth in the Medicaid program who are receiving a SUD-related service, again, we're talking about 1%. less than 1% for the uninsured population. So again, that is really, we're just not getting the saturation of services that we need. We know a lot of things play into that, right? Just availability, and availability is a big thing, right? Is the service even there? Does someone even know about it? Do they have the language to be able to find the service in their community? Is it reputable? Is it, I don't mean, is it, let me say that differently. Is it well trusted in the community? And what about the stigma, right? The stigma for the youth, for the parent. So there's a lot of things that go into genuine access, but regardless, for all of those factors, and there are probably more, people aren't getting treatment. Children are not getting treatment. We're not getting the penetration into treatment. And I know you could easily say, well, you're not looking at other insurance. And what I will tell you is that I bet other insurance is actually worse. And that, I don't mean to be a downer. We just know that the benefit, the substance use treatment benefit, is quite robust in the public system. It's very robust. I'm grateful to providers who take Medicaid. We will shortly have the entire ASAM continuum covered under Medicaid. And those wonderful providers who take Medicaid are also seeing kids who are uninsured. And so we do have a robust benefit package, probably in most cases far more robust than with people who have other payers. So I don't suspect their numbers are any better. That's just saying across North Carolina, we're not reaching enough children. And you all know that the public system largely sets the pace and the way in this system. I promise I'm not knocking private insurers. If you're on the call, I'm grateful that you're here and I'm grateful that you're a partner. It's just, we're not seeing enough folks engaged in treatment. And so one of the things we're trying to do, we're going to talk about prevention in a second, but one of the things we're really trying to do is get folks more access to services. It's desperately needed. So share some data with you. And this is not a shameless plug for continuing the youth and young adult survey, although it's really vital. But if you look at the youth and young adult survey, what you're going to see, not surprisingly, are the substances that youth and adolescents in North Carolina use, which persistently are things like alcohol, cigarettes, vaping, marijuana, and then prescription medications. And you'll see an interesting trend, right? The prevalence and use of these substances grows as we go through the age ranges, right? So again, not surprising. We see that data held up everywhere. If we look at, again, not surprising, but I'm showing you this data so to sort of explain why we do the things that we do. But again, you're experts, so you know. Most people get their substances from a friend or from home. So if you look at the darker squares, you look at where, okay, so kids are using alcohol, they're smoking, they're vaping, they're using marijuana, in many cases, prescription medications. They're getting it from friends. And then when you look at prescription medication, a lot of that is availability, either through a friend who had the medication unlocked and available at their own home where the medication was unlocked and available, or even they're misusing their own prescriptions. None of this, I don't think, is startling or surprising. When we look at where alcohol is, it's typically available in most places in the house, either your fridge or a cabinet, a bar cabinet, and in most cases, those things are unlocked. So these kind of statistics drive our prevention work. And why am I talking about prevention? Because primary prevention is really important to us. I just had a really great meeting this morning with my chief clinical officer for substance use prevention, treatment, and recovery. And she was starting to unpack some of the work that we're doing to refresh our primary prevention strategy here. So this is the data we've been using, and that has led us to do the things that we do, which I'll explain in a minute. I want to share also some information on prescription medication misuse. Again, not surprising that we see a trend of as youth age, there are higher rates in those age brackets of prescription medication misuse. So we know that, and we know hitting preventative at any level here, preventative strategies at any level, and they may be different because of different developmental stages, is really critical for us, and so we're focused on all of those. These are our typical core prevention strategies that we're using here in North Carolina. So we do a lot of statewide prevention education. You're going to see more of that, so stay tuned. On the next slide, I'll tell you about some of our campaigns. We do a lot with local coalitions. So we use data to actually target communities with higher rates of use, misuse. It could even be overdoses, higher levels of poverty. So some of the indicators that drive where we should do these services. So we work with communities and fund evidence-based treatments in communities. We also have the SINAR program, which you're familiar with. I think I have SINAR data. I do. I think I have some SINAR data. So we monitor retailers to see if they're selling tobacco to minors. And of course, a major funding source for us is our substance use prevention and treatment block grant we get from the federal government, from what was formerly known as SAMHSA. I'm still going to call them SAMHSA until someone tells me to stop. And we do have a set aside for prevention. We do not know the future of it. We assume the grants will be okay. We don't know if the way we can use the funds will change, but prevention is important to us. So unless we're forced, we don't see ourselves scaling back on prevention funding here in North Carolina. Prevention is critical. These are some of our statewide prevention campaigns, right? Again, remember, alcohol continues to be a persistent issue. It's readily available in homes and unlocked spaces. Same thing with meds. Folks are getting them at home. Their friends are getting that home. So we have the Lock Your Meds campaign and the Talk It Up, Lock It Up campaign. Really cool things are happening though. So we are changing hearts and minds. Through the Lock Your Meds campaign, we are seeing a huge increase in people that are thinking about storing their medication differently. Never occurred to them before. And they realize that they need to store it in a different way or in a locked way. We've increased the number of people who believe they have to do that. We've increased people who are using actual lock boxes to store their medication. So it's been a really successful campaign for us. This is just an example of how we have changed over the past couple of years with this campaign and other things, right? Lots of wonderful interventions locally and at the state level, focused on both locking up medications and disposing of unused medications. So just educating people about why that's necessary, even providing lock boxes or making it very easy, like communities who have places to get rid of unused medications in a safe way. It's really helping the availability of those prescription medications, especially opioids. It's helping to decrease that availability to young people. So those are really important. And again, more people are using those lock boxes at home or dropping off their meds. So this is just more data actually showing the impact of local programming and statewide campaigns. This is our SINAR data. Remember, SINAR is important for us. If you don't know about it, you probably do. But we're required by federal law to monitor retailers who sell tobacco products. We have to monitor that they're not selling tobacco products to children under 18. And if they do, it's a violation. Red means we are over the number we're supposed to be over, you all. So that drives a lot of our work to actually, and we're rethinking, how can we, there's laws, certainly there are different laws that can be changed, but is there more we can do to educate communities and target specific communities with high rates of retail violations? So there's a lot of prevention work happening in areas where there are high retail violations, lots of tobacco retailers. So again, this is something we'll continue to do. Certainly, we're required to do it. But this is really important since, again, smoking and vaping are two really big, persistent substances that young people are using here in the state of North Carolina. So prevention is really important to us. So prevention, we're going to keep focused on prevention. We're working on revitalizing our prevention campaign. So stay tuned. We're actually going to be posting our prevention strategy and would absolutely love both your feedback and your partnership. I also mentioned access, and part of access truly is stigma. We have been working actually with local communities now to create our Unshame North Carolina campaign. It's pretty opioid use specific, but there is some substance use messaging in there as well. But the whole notion is that we need to, and this is particularly important for youth, right? It's more for everybody, that folks don't need to be ashamed if they need help, if they're using opioids, if they're using substances, and we don't want the shame to keep them from living life. And that's everything. When you think about youth, it's being able to actually get treatment, but it is also other ramifications that are caused by stigma, right? The way they might be shamed or treated differently in school, the way they might be treated with punitive measures rather than treatment support. there's just a lot of shame. And when adolescents and children are met with shame when they're using substances, um, that is when use can escalate. Other adverse events can happen. And certainly we don't see the good things happening, right? Children getting treatment or adolescents getting treatment, their parents understanding and being able to help them with the process, their school helping. And so stigma is a really big problem for us. So we're very excited about this campaign. And the First Lady is actually supporting this campaign as well. So we really, truly appreciate her support. So you all know that we also, I think you do, we try to collect outcomes data in our system as well. So we have a North Carolina specific tool. It's called NC TOPS, and we measure outcomes across many of our mental health and substance use services. And in some cases, we're able to measure outcomes specific to youth. And what we see is actually really good. So this is just an example of some of the outcome measures we look at. Some we want to go up, right, like emotional health, and some we want to go down, like school suspensions and expulsions. And so what we see in our data is that adolescents who do have access to treatment here in North Carolina in our public system are getting better outcomes after only 3 months of treatment. So that's actually really encouraging and exciting. We just need to make sure that we have more availability of evidence-based treatment for youth. We'll continue. I know some of that data, I didn't focus on it. I focused more on the adolescents, but remember all that data we looked at. And the data that we do know is that, and this isn't primary prevention anymore, but use truly escalates across substances when individuals go to school. So again, we're hoping to prevent use. If young people are using, we're hoping to get them in treatment because we do believe it is effective. If they are in recovery when they go to college, right, we want them to be able to maintain their recovery. So our collegiate recovery programs are incredibly important to us. We're in 18 schools right now, and we will continue our focus on collegiate recovery. So that's helping people maintain their recovery while they're in college. And we're also exploring and kicking around harm reduction as well. Okay, so for a lot of people, that is when the use they maybe experimented or did a little bit in their adolescence can turn into a full-blown misuse. Use escalates dramatically. So is there things we can do about responsible use for kids in college? The last thing I'll mention is this. I don't think we've announced it yet, so forgive me if we have and I'm forgetting it. But we used some of our state opioid response money this year to do a public RFP because we need more treatment programs for youth. Evidence-based MOUD programs that include those counseling elements, of course, as MOUD does, and supports for their families as well as wraparound life support. So we're very excited to be able to announce these programs that are starting because, again, we're really focusing on really basic things, but vital things, making sure that we have a solid prevention program. We are working on stigma. We are thinking about those transition age and young adults from a harm reduction and also recovery support way. But that certainly that treatment access for youth and adolescents just needs to be more well-known and available for kids across the state. So that is all. You will get this PowerPoint if you haven't already. We welcome you to join our community. I mean, we are all in the same community together, but every month we have webinars where we try to update folks specifically on things happening in our strategic plan. So we'll be talking about our prevention plan shortly. Just a few months ago, we talked about some of our substance use programs. So come on down. We have lots of advisory committees all the time. That QR code will take you to ones that we have. We welcome you to any of our advisory groups. And of course, the mailing list, we send out 2 mailings every single week. If you don't find them interesting, ignore them. But a lot of times we celebrate you, we celebrate your activities and milestones, but we're also able to advertise things like funding opportunities in our system. So thanks for having me here today. And with that, I will turn things back over to you, Jeremy, and stop sharing.
Thanks so much, Kelly. There were several really good questions that came in. If you have time for one,
Yeah.
equity, and then we'll pass some of the others on to you later. Just a lot of good comments about the great work the department is doing and specifically your leadership and the work of your team. This particular comment mentions the department's outstanding commitment to equity. Do you know, or are you aware of if there are equity dashboards or data reports tracking how SUD treatment access varies across different demographics or systems?
Yeah, great question. And so yes, we do. And there's one that I show a lot of times when I look at our OTP programs, right? Our OTP programs are extraordinary. But we have a graphic that we share routinely, and it is driving a lot of our work where our OTP use continues to grow. More and more people are getting access to OTP programs, which is truly exciting. But the vast majority of people attending those programs are sort of young through adult, white folks. And that is fantastic. But we know we're not reaching Black and Indigenous people here in North Carolina, and we're struggling to meet the needs in rural communities, which is part of the deployment of the mobile units. But that is the most obvious one that comes to mind. But yes, there's a couple of dashboards on our site when you look at reports. It does look at it. We have lots of publicly available data that we share routinely about prevalence, but also we look at service trends. So you can see service trends for different categories of service, and you're able to disaggregate that data in multiple ways.
That's really helpful. I know we're at time. We appreciate you making time in your busy schedule to join us today. We're excited about the impact of the programs and the people across the state are making to serve adolescents. There are some great questions about mobile OTPs, about the Parent Bill of Rights, and some other changes that are taking place. So we'll share some of that with you
Great.
and hope to communicate that back. But we look forward to seeing you at other events, and have a wonderful rest of your day.
Thanks, Jeremy. Bye, everyone.